So following cardiac enzyme pattern, liver enzyme pattern and pancreatic enzyme pattern, we'll move into the bone enzyme pattern. So bone formation and bone remodeling involve certain enzymes which increase the activity indicates the bone disorders. So coming to the bone enzyme, the main enzyme is ALP, that is alkaline phosphatase, which mainly involved in the bone formation and mineral deposition. So in bone formation, in osteoblast and osteoclast plays a major thing. So osteoblast is nothing but the formation of new bone, and osteoclast is breakdown of the old bone forming tissues. So this ALP is mainly involved in osteoblast, that is the helps in bone formation and mineral deposition. So calcium and phosphate gets mineralized deposition and it leads to the strengthening of bones. And the normal range is 44 to 147 mu per L. Abnormal values of above 147 u per L, it indicates the rickets, osteomalacia and Fagot's disease. So in vitamin D deficiency, the rickets and osteomalacia plays a major role, and apart from the Fagot's disease, the renal calculi, that is the accumulation of kidney stones, also majorly plays a drawback in bone pattern, because vitamin D gets absorbed in the skin and it further moves into the liver, and liver it goes to the intestine, and in intestine it goes to the kidney, and kidney it goes to the bone. So far the vitamin D gets absorbed from skin to bone tissue because the absorption level is so higher, and the bone mineralization of calcium and phosphate ions also involved for the strengthening of bone, and this should be maintained to prevent the disease of rickets, osteomalacia and Fagot's disease. And in the pictorial representation you could see the osteomalacia patient. So osteomalacia is majorly affect the adult, where rickets majorly affects the children. So osteomalacia, the softening of bones. Osteo means bone, malacia means softness. The bone softening condition is osteomalacia, and osteoporosis where pore gets spongy and the bone also becomes spongy, and it is the loss of strength. And in rickets you could see the bow-like structure, so bow-leg-like structure, because the rickets in Latin word meaning ricken, that is twisted, the twisted leg has been seen. And in Fagot's disease, the one leg is normal and another leg it should be bow shaped and it should be curved, and this is all about the bone enzyme pattern. And coming to the prostate enzyme pattern, this prostate gland is mainly for men semen liquefaction and reproductive function. So for the reproductive fertility of men, this prostate gland is important, and it mainly serves as the semen liquefaction property. And this enzyme acid phosphatase is mainly involved in the prostate enzyme pattern. So if the prostate gland functioning properly, this acid phosphatase enzymes are in normal range, and this is involved in the phosphate metabolism and semen function, where semen motility and semen liquefaction and the semen's liquefaction property. The normal range is 0 to 5.5 u per liter. Abnormal of above 5.5 mu per liter, it indicates the prostate cancer. So this prostate cancer mainly affects the men who are over age above 50 or 60 years, because due to the gradual decrease in the enzyme activity of acid phosphatase. And moreover, a specific antigen is found in prostate, that is a prostate specific antigen PSA, and this antigen is also be monitored for any functioning and malfunctioning of the prostate gland. And this is mainly all about the enzyme pattern in diseases, where we have seen about the cardiac enzyme, which is for myocardial infarction, and liver enzyme for liver detoxification and metabolism, and bone for bone mineralization, and pancreatic that is carbohydrate and fat metabolism, and finally the prostate. So this is all about the enzyme pattern in diseases.